We don't lobby, remember that. But we do go to Washington for the CADCA, Community Anti-Drug Coalitions of America. We've gone as part of our grant, and we are able to share data from Raymond. We're able to talk about the great work we're doing here in the community, and it's great to be able to be so in touch with people who are advocating for us at a federal level. So with that,
well, good morning, everybody, and Celeste, thank you for the introduction. Thank you for the great overview of all the extraordinary work that you and the entire coalition team have been doing. It's really a great way to start Friday morning. And it is great to see such a broad cross-section of community here as well, to the students. It's great to see you here, to all of the first responders and the local officials, educators and advocates, not lobbyists, advocates. It is really just terrific to see you. I also want to welcome our keynote speaker, Christine McNulty-Grant. Thank you for being here. I know everybody's really looking forward to hearing from you. And I want to congratulate today's award winners as well. The town of Raymond and your relatively new town manager, Joe, and I realized, is it Isley? Okay, I just want to get the last name right. But welcome and thank you for your work. To John Delana, thank you for your continued excellent work on the law enforcement side of things and for the way you work with community. Fighting this epidemic has really required a partnership. Students, citizens, law enforcement, public health, everybody coming together. And John, you've been a real leader in that, and we are grateful. And I don't think officially met Alex yet. Alex Cooney, can you raise your hand? Alex? I heard Celeste say that when you went up to advocate in Concord, maybe there was a heckler or two. Well, there shouldn't be a heckler in our state capital or in our nation's capital. And that's not what business as usual is supposed to be, but I'm very glad for your strength and your determination. Thank you for doing that. It's really important. And for everybody here gathering together to mark another important year of the work of the Raymond Coalition for Youth, thank you for taking time out. Thank you for focusing on the importance of this coalition, and in doing that, really sending the message that coalitions like this throughout our communities, our state, and our country are in fact what bring about change and truly make a difference. We all know far too well the painful impact that the substance misuse crisis is having on our families, on our communities, on our economy, our entire state, and our country. New Hampshire was at the beginning of the fentanyl epidemic and felt the impacts of that very, very strongly and deeply, and our mortality rate continues to be an outlier in the country. But I will tell you that in talking with my colleagues from around the country, we are not alone in this particular challenge. And I believe that as we are coming to terms with our challenge and organizing as the coalition has, we are also showing other citizens around the state and country of the kind of work we're going to need to do together to turn the tide on this epidemic and really bring about change. Far too often, the substance misuse crisis impacts young people in New Hampshire, sometimes because they develop a substance misuse disorder themselves, sometimes because they feel the impact of it in their families or in their community very, very starkly. We know how much the substance misuse crisis and the ripple effect of it has hurt the development of our young people and their long-term health. And that's why the support services provided by the Raymond Coalition to counter that negative impact and to help give people the tools to stand up, advocate, fight, and get better is really an incredibly important thing, and has had really, as we've seen from your data, a positive impact on young people in the community. You're doing vital work to bring stakeholders together, to empower young people, and to prevent substance misuse before it starts, which is, of course, the ultimate goal here. more important than anything is the work that so many of you in this room and beyond have done to end the stigma that comes with substance misuse. Until a lot of you stood up and really talked about the reality of this disorder, the reality that it hits people from all walks of life, that people develop the disorder for different reasons and in different ways, but that it is a disease that needs to be dealt with as such. Until you all did that, the stigma kept us from dealing with this issue the way it needed to be dealt with. You all should be incredibly proud, because being the first person or even the second or third person to stand up and say this happened to me or this happened to my family is really difficult, but it made all the difference. It has allowed me, as I advocate in DC for resources, and it allowed me as governor here in the state to kind of sometimes take people by the lapels and say, this is a substance use disorder, this is an illness that hurts everybody, and it impacts everybody. And it's not an issue of character, it's an issue of disease. And it was your voices that made that difference, so thank you for doing it. The numbers that Celeste just showed are incredibly impressive. We obviously have more work to do, and I want to just touch on a couple of things that we're trying to do in DC to help you all do the work that has been so essential. My top priority is ensuring that our communities have the resources they need to combat this crisis. And that means working with members of both parties to strengthen prevention, treatment, recovery, and law enforcement efforts. Celeste talked about the importance of continuing the drug-free community grants. We are working as hard as we can to advocate to do that. I do want to let you all know, too, that at a time when what you hear out of the news about Washington is about partisanship and discord, there is bipartisanship and unity about addressing this issue. And I want you all to understand that you don't hear about it on the news because it doesn't make great TV, I guess. But we are working together to try to bring resources to our communities. This is not a partisan issue, and I want you to know, too, that one of the reasons it isn't is because you all have done such a good job of shining a light on the disease and helping people understand that it impacts everybody. I've worked with our congressional delegation to secure more than $50 million over 2 years in additional federal funding for New Hampshire to support your frontline efforts. It's not enough. Last year, the President signed into law the Support for Patients and Communities Act, which took many steps forward, including establishing comprehensive opioid recovery centers. That's a place where we're going to be able to do integrated work and develop best practices that can be shared all across the country. It supports law enforcement in efforts to curb fentanyl shipments through the Postal Service, because as you may know, fentanyl comes through the mail. It's so lethal in such small amounts that it's very easy for smugglers to just send through the mail, and we had to make sure that the Postal Service had the instruction to and the tools to stop it, to inspect packages and find out the source as well. We're expanding access to medication-assisted treatment, and I'm also working with Senator Murkowski from Alaska to finally end the requirement that says doctors have to get a special waiver before they can do medication-assisted treatment. We need more healthcare professionals on the front lines who can help with this disorder, and that provision in the law that says doctors have to get special permission to do it is incredibly outdated and in fact related to the stigma that kept us from dealing with this for so long. So we're working on that, as well as pushing for millions more in funding for programs related to mental health, substance use disorder, and suicide prevention programs for youth. That is part of the push we have in our federal government spending bill for 2020. I'm also co-sponsoring the Mental Health Services for Students Act, which would establish grants to help schools provide much-needed on-site comprehensive school-based mental health services for students. We have some good pilots in New Hampshire where we're working on that. We need to make this more available in all of our schools. And I'm co-sponsoring something, it's another bipartisan bill called the Stand Up Act, which would provide middle and high schools with suicide prevention training and improve the safety and security of students by establishing a set of guidelines and protocols for when the threat is identified. I wanted to touch on a couple of things that Celeste brought up. Vaping. First of all, we have been pushing for a while now to get the FDA to keep any of the e-cigarette manufacturers from marketing their products to children. They kept saying they weren't. We kept saying you have all these special flavors that clearly were designed and targeted at kids. They have come off the shelf, as you all know, but we have a lot more work to do to push the FDA to do its job to understand the health impacts of vaping. I was in Nashville yesterday and asked third graders how many of them knew what e-cigarettes were. Their hands went right up. They actually told me we should just ban them altogether. It was a very active group of third graders. But a lot of them said their older siblings vaped. They knew about it. Fifth graders knew about it. It's something we have to take serious action on, and we're pushing the FDA and CDC to do that. On the marijuana issue, I really appreciate, Celeste, your presentation. I have been pushing to allow the CDC and NIH once again to actually study the impacts of marijuana, because there is perception out there that it's perfectly safe. And we know from some studies, especially for young children, it isn't. But we need to have the research. And for the young people in the room, I would also, if you want a study project, one of my concerns is that just the way big money drove our tobacco addiction, I'm very concerned that big money is going to start driving a marijuana addiction. So we have to really be aware of the intersection of the desire for people to decriminalize or legalize marijuana and the financial interests that will come to play if we totally legalize it or don't regulate it really, really carefully. Look, we have a lot of work to do together to address substance use disorder when it occurs, but more importantly, to prevent it from occurring in the first place, and that's what you all do so well. We need to support those who are struggling with addiction. We need to realize that recovery is often a multi-step process, and that there are relapses just as there are in other illnesses. We got to stick with people. We got to gather data. We got to make sure we're giving them options so that they can get better in a way that works for them. We didn't get here overnight. This epidemic developed over time. It is going to continue to take us time to turn the tide and truly beat this epidemic and get better. But we are making positive steps, and that starts with all of you. Celeste said and pointed out that the theme of roots in the community was this morning's theme. And I am struck by how important the work you do is not only for establishing roots when it comes to drug-free communities and making sure that we have the prevention tools we need, but roots in the community really speaks to what we need to do to keep our democracy healthy as well. For the young people here, the skills you are developing in advocating for yourselves and for your classmates and for better, safer, healthier communities are the same skills you will need to have your whole life to be effective citizens in a democracy. We believe in freedom for individuals, and we believe in dignity for individuals because that empowers people. And it is empowered people who come together, who make strong communities and who make strong democracies too. That's more than anything what I see when I talk to members of the coalition and when I look at a room like this. In New Hampshire, we love freedom and we love individualism, but we build incredibly strong communities because of that love for each other and our belief in the power of the individual. You are empowering individuals every day with the work you do. I couldn't be more proud of it, and I couldn't be more grateful for it. Thank you so much, and have a